What about vitamin supplementation? I know folic acid is important. Can you hit on that a little bit?
Folic acid is very important. The minimum is 400 micrograms. I like to do 800 micrograms. Now, some people have a deficiency called MTHFR. It's basically the enzyme in our body that converts folic acid and it changes it to folate, reduces it. Well, folate's basically the active form in our body. Well, if you don't have the enzyme, or you may have one gen, not another, you're not going to make enough. So if you do L-Methyl, which is basically you're taking a reduced form, so you're kind of bypassing that, is a nice thing. And if you know you have MTHFR, you should take that all your life.
Well, I'm a big believer in just taking, the methylcobalamin and L-methylfolate anyway. It might be a little more expensive in your vitamin supplement, but 57% of the population is, MTHFR deficient. So why not just take that? If you're going to take it in a multivitamin, you should just take it with those in there, is what I believe.
One of the things that I stress with my ladies that talk to me or to younger women is that being healthy before we have children is extremely important. I think those things are easier to get a hold of prior to becoming pregnant than it is being pregnant and then trying to, oh my gosh, I have gestational diabetes, or I have, different things.
And actually, just one thing came to mind. It's like you're talking about L-methylfolate. One thing is too, like depression, anxiety, and pregnancy affects that. And so you'll see it come out in pregnancy, during pregnancy, especially right after delivery. One of the biggest times that's important is after delivery, you have a spike as far as postpartum depression and anxiety. And a lot of women think, oh, that's normal. I'm like, why am I connect my baby? Well, that is important to be aware of. And if you notice it, to kind of contact your healthcare provider. But the other thing is too, that's where L-methylfolate has actually shown some benefit to decreasing, depression is important, because if we keep you healthy, then you'll have a better time raising your child. You and your baby will do better, and your whole family relationship will be better.